These DVDs are for all body therapists and also anyone interested in healthcare, orthodox or unorthodox. They should find it very interesting. And basically, body therapists are not prominent people. We work quietly away in the background, and a lot of healthcare people have no idea what's actually achievable with body therapy. So I'm hoping to set that right a bit. Basically, anything that says it's clinical or therapy or therapeutic or remedial or is treatment, it must have a really solid clinical framework. And I set those out in the early lectures. And the more solid that is, the more you know whether you're actually doing well, and you follow up your results and there's clear progress in cases. The clinical framework is essential to good work in healthcare. And these lectures have been developed from study groups that I've run in my practice. I usually have a 3-hour session every week for about 8 weeks. But they're not scripted, so with it being unscripted, I tend to pause a lot, and the pauses often are for where there would be discussion in the group, and I'm also editing out a lot of the points that usually emerge in group discussion in order to just keep the flow of the lectures to camera. One important point in body therapy is to know when to stop, and there are times when you must stop the body contact, especially when people's sexuality is emerging as an important issue, and when there's been any violence, also when acute grief or bereavement is emerging. These are things that actually make you schedule a time just to sit and talk, and maybe prepare the person for referral elsewhere if that's the right move. And it may be you won't continue body therapy after those sessions, but you can negotiate that with the patient. But that point I forgot to bring out in the DVDs, but that's important. So I hope you become more and more familiar with how emotional and social pressures build up for the person, for their body, how they cope with them, how they can have such radically interesting effects and clinical problems that emerge, and how we can approach sorting them out. I also hope you have a very fertile imagination, because a lot of this is to do with human subjectivity and imagination and fantasizing and reverie and all that sort of thing. So reflect on this, mull it over, see how it refers to your own thinking and practice. And basically everything I'm offering is fertilizer for your imagination. So enjoy the fertilizer. Welcome everybody, good day, and I'm Phil Latey. I'm presenting a series of talks all about body therapy, and it's going to be put on DVD for everyone to look at. So this is very exciting for me, first time I've tried anything like this. And I'm going to tell you first of all a little bit about myself. And I'm an osteopath. I qualified in 1972 in the UK in London. And to me, osteopathy is everything that you can do with hand and voice alone. So while I'm looking at healthcare in very general view of healthcare with all the models I'll present, the basic aim is to get body therapy, good body therapy happening with more and more difficult problems. And we'll talk some more about that as I go along. Now, from 1972, I practiced in London, did quite a lot of teaching, British School of Osteopathy, and supervising the clinic there. But since 1988, I've been in Sydney here in Australia, and have got a nice practice going here, and a little bit of teaching from time to time at the universities, Auckland, New Zealand. I've done a couple of courses in the USA as well. So, just to look at what I'm going to present, a lot of this material comes from published papers that I've produced over the years, and I've arranged to have them all on my website. So if you have a look at www.philip with one L, Latey, all one word, .com.au, and that will actually have all my published work available to download, including a book I wrote in 1979 called The Muscular Manifesto. And that was a great effort to try and bring together all the different understandings of sensory motor functions, mental functions, social, and many other factors, and see where they all begin to connect together. And there were quite some surprising ideas in that that still have a long way to filter through, but I'll be presenting them as I go along. One other thing about me is that I'm albino. I actually have no pigment in my skin, my hair, in the back of the retina of my eye. So albinos are born with actually very, very poor eyesight and light sensitivity. Luckily, we can now film this at a very low light intensity, and that's fantastic for me because I can actually keep my eyes open while I talk to you. So, all right, albino, osteopath, coming up to 36 years of practice, and I'm going to talk about 4 different areas that I link together. First one being clinical understanding, and that's basic models of clinical practice that help us to improve what we're doing and understand it better. The function of the muscles, neuromuscular function, and some interesting things about muscles as sensory system that we're going to come on to. The emotional and social and the mind and the sort of pressures that build up and how that all functions, I have a contribution to make. And linking all this together are the tactics and strategy that we use in clinical work to make life better for the patient, how we integrate different factors that are giving them problems. And there's lots to say about tactics and strategy. So we've had a good look initially at the way muscles may be layered into those 4 layers, so the deep involuntary ones, middle layers, and then the outer layers. We're now actually going to go and look at how tensions evolve around the pelvis and the lower body and the tightness that builds up there. Overall, muscles really are quite simple. A lot of the behaviors we see are just like the iris of the eye. Under stress, things tighten. When they relax and let go, they loosen. And they get bigger and they get smaller, and they get narrower and they get broader. So it's a beginning of an understanding and a grip on what muscles are doing and so on. And also starting to familiarize yourself much more with anatomical function and getting a feel of it, and being not afraid to be almost closely engaged with the patient's body at the same time as having a polite, tactful conversation with them about the mother-in-law or whatever it is that you think is going to help them make light of some abrasives in their life. I'm looking now at another picture. This one's from my paper on complexity, I think 1997. And this painting here gives you a cartoon of the whole of the human life cycle, all abbreviated into different phases. So now we're looking at some practical technique to go with session 4, upper body tensions. And again, I've got my lovely sitting and patient side lying position. He's nice and free in the midline there, so what I'm feeling is the sort of flow and movement of the body as I'm starting a bit of technique. Now notice that my upper arm here is resting round the shoulder girdle, and through that I can feel the float of the scapula as it's moving up and down on the thorax, inwards and outwards. If I'm resting a little bit, I can feel the breathing movement. It breathes in and it breathes out.